Welcome to Sport and Spinal Weekly, brought to you by Chiropractic Sport and Spinal Rehab. Listen each week for health and wellness programs and ideas, chiropractic information, and helpful tips for a healthier lifestyle. Plus, weekly guests from around the area. It's time for Sport and Spinal Weekly with Dr. Lyle Erickson and the team at Chiropractic Sport and Spinal Rehab.
Have you ever been told you just have to live with the pain? Far too many people today are living needlessly with pain and taking drugs to hide their pain. Every day, many people just like you are learning chiropractic care can be an effective alternative to drugs and surgery while restoring pain-free living.
For quality chiropractic care, call Chiropractic Sport and Spinal Rehab of Bemidji at 444-2117. Whether caused by an auto accident, work injury, or other circumstance, receive expert treatment from Sport and Spinal Rehab. Sport and Spinal Rehab will accept most insurance, so give them a call. That number again is 444-2117, or find them on the web at www.sportandspinalrehab.com.
Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
For more information, visit Chiropractic Sport and Spinal Rehab online at www.sportandspinalrehab.com.
Good morning and welcome to another edition of Sport and Spinal Weekly. With me this week, Dr. Erickson from Chiropractic Sport and Spinal Rehab. Good morning.
Hey, good morning, Mark. Good to be here again.
And some nice weather, and we are certainly going to enjoy that as this is the time of year. The time of year, I think more Minnesotans are active. There's certainly a lot of folks that are active throughout the year, and they have a weight training program or whatever it is, walking. But I would say more Minnesotans now start getting out of the house and stuff and get active.
Well, there's no doubt. It's a testament. Just look around town today, and you'll see the boats out, and people are going fishing now. A lot of bikes, a lot of people running, jogging. So doing yard work, gardening. So yeah, it's the time of year to get out and get busy doing some stuff.
And with that, our topic today is going to be
tendonitis.
Tendonitis. Now, is that something that can be developed when we start working stuff that hasn't had a little action for a while?
Well, that's one of the main causes, I guess, of tendonitis is, first of all, tendonitis is inflammation of a tendon, basically.
Okay.
And it's one of the primary causes is overusing something. And or using it, like you just said, stressing something that hasn't been stressed for a while with the muscles and the tendons. So it's a topic that I think a lot of people will relate to, especially this time of year when they're out doing a few more things.
That, and I think a lot of people, we self-diagnose ourselves. So if our tendon hurts, we just say, oh, I have tendonitis. And
yeah, it's you can call it, it's kind of a junk term, and what we'll talk about today are some typical spots where people will develop tendonitis.
Okay.
And maybe help a few folks kind of properly diagnose or at least have an idea of what's going on, and then maybe talk about some ways to treat it.
We'll talk about that coming up. It's a Friday edition of Sport and Spinal Weekly with Chiropractic Sport and Spinal Rehab. Remember, you can always email Dr. Erickson and the staff at sportandspinalweekly@paulbunyan.net. Ask a question. Ask us to have a discussion or topic for the show, and we will certainly respond. So that's sportandspinalweekly@paulbunyan.net. We'll talk tendonitis when we return. This is Sport and Spinal Weekly on 92.1 The River.
Hi, I'm Erica at Chiropractic Sport and Spinal Rehab. I assist the doctors with patient care, exams, therapy, and x-rays. Call us to find out how we can help get you out of pain today.
Hi, I'm Paul.
And I'm Rita of Live in Touch Massage. With spring in the air and yard work to be done, you may end up with a few aches and pains. This would be a good time to experience the benefits of massage and body work.
You can check us out on the web at www.liveintouchmassage.com. To schedule an appointment, call 368-2963. Come, experience the difference.
Living Touch Massage is located just off 5th Street on Meg 7 Court in Bemidji.
Now's the time to step up to a new vehicle with Honda of Bemidji and Bemidji Chrysler. They're going to give you top dollar for your trade. Plus, check your mail because you might have already received a trade-in voucher worth $1,000. Drive in. Get the best value for your trade now at the area's new and used vehicle superstore, Honda of Bemidji. and Bemidji Chrysler.
Hello, this is Ken Cobb.
And this is Jim Philippi, and we're from Pine Country Insurance in Bemidji.
You know, Jim, in these tough economic times, clients want to save money on their home and auto insurance.
That's right, Ken. And it's also important to help them get the coverage they need. Because when a loss occurs, how good your coverage is will be what matters. You know, Ken, having a good insurance is about more than just getting a good price.
I suppose you're right, Jim. So give us a call at 444-9360 so that we can help you customize coverage that fits your needs, desires, and budget.
Pine Country Insurance Agency, your trusted choice in Bemidji.
Online at pinecountryinsurance.com.
Ranger Station.
Yeah, hi. I'd like to report a bear sighting in the forest. 1 second, I'm having a smoke. Next thing I know, I'm face-to-face with Smokey Bear. Wow. And he told me it only takes one spark to start a wildfire.
Did you know 9 out of 10 wildfires are caused by humans?
I had no idea.
That's why Smokey's famous and you're not. If you see someone in danger of starting a wildfire, step in and make a difference. Brought to you by the U.S. Forest Service, your state forester, and the Ad Council. Learn more at smokeybear.com.
Only you can prevent wildfires.
You're listening to Sport and Spinal Weekly on 92.1 The River.
Okay, we are back. Sport and Spinal Weekly in the studio with me, Dr. Erickson, and we're going to talk tendonitis. And before we took the break, I think I did give a kind of a general term. I think a lot of people have said that their tendon hurts or what they think is a tendon, and when we say, "Oh, I must have tendonitis," and so how do we get to that assumption?
Well, as I said in the open, tendonitis is a term that basically means there's inflammation of a tendon, and lots of different things can cause that.
Okay.
Overuse is probably the most common cause of tendonitis, and of course, by, like we said, doing activities that maybe we haven't done for a while or doing them more repetitively than we've done can cause more movements in the tendons. And cause inflammatory response or inflammation in that tendon, which ultimately creates some pain.
And we're going to have like our own version of reality radio, interactive radio. Can we kind of self-diagnose ourselves today? Is that what you're alluding to?
Well, I think you can to some degree. Of course, if you have pain in an area and it's best to get things checked out by a professional. However, it might give you an idea of, hey, that sounds like something I've got. Maybe I should get it checked. Okay. First, I should step back and just define maybe what a tendon is.
Okay.
A tendon is a piece of tissue. It's a very strong piece of tissue that connects the muscle to a bone. And so when a muscle moves, contracts, and it moves a joint, the tendon is attached to that bone, and that causes the movement of the joint.
Ah.
So when everybody's common with the biceps muscle.
Right.
Okay. So I'll try to explain this so people can envision it. We have a tendon that connects the bicep muscle to the bone.
Okay.
And that allows us to basically flex our elbow. And so you can develop over time, overuse or improper movement, you can develop inflammation in that tendon that can cause some tendonitis, and that's just one of the tendonitis conditions that we see is what we call biceps tendonitis. Most often developed in the shoulder area, in the anterior part of the shoulder. So that's just a description of what a tendon is, and how basically the tendon functions in the body to help move the joints.
And are tendons always like in such a major part of shoulder, or is that a tendon? Like, can you look at the backside of your wrist?
Yeah, if you look at the front side of your wrist that's going through where the carpal tunnel is, or the going into the palm, those are tendons.
Okay.
Those are the wrist flexor tendons. That's a common spot to get tendonitis, actually up in the elbow area where those tendons attach. So if you look down on your arm from the front, the inside part of your arm, you'll feel on that little knob there. Right below that knob is a little. You'll feel it kind of rub over there, a little kind of a nodule. Well, that's a tendon right there, and that's a tendon that controls the wrist flexor muscles. And if that one gets sore, oftentimes that one will get sore during golf. We call that golfer's elbow.
Okay. What about tennis elbow? Is that a different?
I'm glad you asked. That's the exact same thing on the opposite side of the elbow. So if you can feel on the outside of your elbow. Okay. You can feel those tendons there. Those are the tendons, the wrist extensor tendons, and those are the tendons that help bring your wrist upwards. and many times in tennis will irritate those tendons, and the term for that is tennis elbow.
I see.
Now, you don't have to be playing tennis or golf to develop conditions of that tendonitis in your elbow.
I suppose anything with that same motion or pattern?
Exactly. So we'll see a lot of tennis elbow in people who will maybe run like electric drills or screwdrivers or painters. People who are doing repetitive movements with the hands will develop a tendonitis up in that tennis elbow area, the outside part of the arm.
So what a lot of people do, I suppose, in the early stages of, we just take like ibuprofen or something, right? And
yeah, you'll notice it's, it'll be sore. Sort of the touch, probably if you bump it on something, or if you rub that area, it'll be sort of the touch. The second thing, many times it'll start aching a little bit.
Okay.
Primarily at night when you're not thinking about it, you'll like, geez, my elbow aches. There's also nerves in that area. The nerves, if you push on those nerves, it'll refer pain to other areas. So oftentimes in patients who have golfer's elbow or pain on the inside of the shoulder, it can actually mimic carpal tunnel syndrome, because the nerve that goes into the hands runs right through that region. So if it's irritated in that area, that can cause some tingling and numbness even in the fingers. So,
which could be separate from carpal tunnel?
Which wouldn't be true carpal tunnel syndrome.
Okay.
Yeah. So
can a person have a carpal tunnel problem and a tendonitis problem?
Yeah, without a doubt. Yeah,
wow.
And that's why when you talk about proper diagnosis of things, you need to make sure if you're having carpal tunnel surgery that you
really need it, right?
You really need it, and most of the the good docs who are going to do carpal tunnel surgery they're gonna do the proper diagnostic test to find that out. But oftentimes, carpal tunnel syndrome surgery can be avoided by working on the tendons if there's a true tendonitis irritating that nerve. So something that's treatable conservatively without having to have that surgery.
Like, I could certainly see where getting the right information would be extremely important.
Mm-hmm.
It's not like it's a heart surgery, but who wants to have surgery, period?
Yeah, if you don't have to go through the pain and all the ramifications of having surgery, why do that?
So then, but the ultimate thing is to not have tendonitis. Is it not like a disease? Once you get tendonitis, you're stuck with it? I mean,
no. Well, that's a good question, because sometimes you can be stuck with it if you don't get treatment on it, and then you continue to do the things that brought that tendonitis on. I mean, it's not something that's going to go away if you continue to do the same things all the time. So, if we're talking about tennis elbow, many people have heard of tennis elbow braces. Okay. It's basically a band that goes around the bottom side of the elbow.
Okay.
And what that does, it just gives that tendon a little additional support and allows that to heal.
Oh.
Conservatively, many times you can do ice on it. Ice is very effective. You mentioned taking ibuprofen. Sometimes anti-inflammatories are fine. One thing you don't want to do is, because you've got tendonitis, take tons of anti-inflammatories every day, and so you create other problems in your body, because unfortunately, anti-inflammatories, the non-steroidal anti-inflammatories, do have some side effects to them.
Right, like some part of our body, the liver or something, has a tough time getting rid of it? Or
acetaminophen has been shown to be can be harmful for the liver, and ibuprofen for the kidneys, and so if we can manage things without taking those things, that's positive. The other thing with tendonitis too is to alter the movements and the way you're doing things. If you know that you're doing something repetitively over and over again.
Like a painter, you brought that up. That's pretty common. Some people paint, you got to paint. Some people paint for a living.
That's what they do, but there's ways to, again, you can brace it. There's ways to hold your equipment. Okay. Proper ergonomics is important. Taking breaks is important, maybe switching hands, different things like that, where you can kind of break that monotony up and break that overuse syndrome up.
What about, do some people, I think of this because I remember back when I was in, I don't know if kids still do it today. I certainly don't smell it, and maybe they came up with something that doesn't smell like Bengay. But, when we were, back in the 80s, sometimes you put it on just so people knew you were in sports or whatever. But as you get older, sometimes it feels good. Or is that more of muscles?
Well, it's both. Like Icy Hot or Bengay. We have a product at our office what we use is called BioFreeze. There's lots of different products out there. Topical, basically they're topical ointments that it might give you some short-term relief. It's certainly not a long-term fix.
It's not really fixing anything,
no,
right?
It's really just giving you some pain relief, which is good. But again, it's probably not going to get to the root of the problem.
Is it harmful for you? I suppose if you have like a skin allergy, maybe?
It can be. I mean, different products affect people differently, but in general, it's pretty non-invasive, non-harmful to be using that stuff. But again, it's more of it stinks. It's more of a topical ointment to give you some temporary relief, to kind of get you through things. But my advice would be to get, number one, find out what's causing it, alter that activity. On your own, conservatively, people can do, like I said, brace it, do some ice on there. In our office, we use different techniques. We'll use deep myofascial release, so we'll actually strip the muscles out because there will be kind of adhesions in the tendons and the muscles.
Kidding me.
And so we kind of go in with our hands and kind of physically strip those muscles out and break up those adhesions, which tends to help a lot.
Wow.
If there's some restriction in joint movement or joint mechanics, we'll do some manipulation or adjustments to the joint. We can also look for muscle imbalance. So if there's an imbalance from one side of the body to the other that's causing or encouraging that tendonitis to develop, we can talk about that. I think I mentioned either last show or the show before, we have a low-level laser therapy unit in our office now, which has been shown to be very effective with different instances of tendonitis. So we use that for folks too. So there's lots of different treatment options out there. Ultrasound, we have that available, electrical muscle stimulation. And so there's lots of different conservative ways to treat the problem and, number one, get you out of pain. And number two, talk to you about how we can prevent that pain from coming back.
Dr. Erickson, we're going to take a break here. When we come back, we'll talk more tendonitis. This time or next time in your feet and your neck. It's Sport and Spinal Weekly on 92.1 The River.
Have you had the misfortune of experiencing an injury recently? Chiropractic Sport and Spinal Rehab of Bemidji is equipped with a comprehensive treatment and rehab program for auto, work, and sports-related injuries.
Chiropractic Sport and Spinal Rehab also offers a complete wellness program for all your health needs. They're committed to helping you achieve and maintain your good health. Call Chiropractic Sport and Spinal Rehab at 444-2117 and visit them online at www.sportandspinalrehab.com. That website again is www.sportandspinalrehab.com.
Sport and Spinal Rehab treats the whole family in a comfortable, friendly atmosphere. Sport and Spinal accepts most insurance, so give us a call. Again, that's 444-2117. Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
Ranger Station.
Yeah, hi. I'd like to report a bear sighting in the forest. 1 second, I'm having a smoke. Next thing I know, I'm face-to-face with Smokey Bear.
Wow.
And he told me it only takes one spark to start a wildfire.
Did you know 9 out of 10 wildfires are caused by humans?
I had no idea.
That's why Smokey's famous and you're not. If you see someone in danger of starting a wildfire, step in and make a difference. Brought to you by the U.S. Forest Service, your state forester, and the Ad Council. Learn more at smokeybear.com.
Only you can prevent wildfires.
Hi, I'm Paul.
And I'm Rita of Live in Touch Massage. With spring in the air and yard work to be done, you may end up with a few aches and pains. This would be a good time to experience the benefits of massage and body work.
You can check us out on the web at www.livingtouchmassage.com. To schedule an appointment, call 368-2963. Come. Experience the difference.
Living Touch Massage is located just off 5th Street on Make 7 Court in Bemidji.
Hi, I'm Nicole from Chiropractic Sport and Spinal Rehab. Stop by the front desk at our office and I can help you schedule your appointment, or you can just give me a call at 218-444-2117.
All right, we are back, and some of these terms, I'm not even going to try and say, what did you say? Plantar what?
Plantar fasciitis.
Is that like not from planting a garden or anything? Because people will be doing that this weekend. Hate to get that.
Yeah. No, plantar fasciitis is, and I'm sure lots of folks have heard about it, probably suffered from it, or certainly known someone who's had it. But plantar fasciitis is basically inflammation of the tissues on the bottom of the foot.
Oh, okay.
And so you've maybe heard of a heel spur before?
Yeah, or a bone. Yeah. I think I've had one.
Yeah. So many times heel spurs will develop because of plantar fasciitis. And what plantar fasciitis is the inflammation of the sheath of tendons and muscles that run from the heel up to the toes. And so when people stress those tissues, there becomes inflammation in that, what we call the plantar fascia.
Oh, okay.
And so the inflammation in that fascia, that tissue, is called plantar fasciitis. And really, it's, in reality, it's probably a form of tendonitis, certainly a form of inflammation of that plantar fascia. So it's really treated very similar to how we'll treat cases of tendonitis.
Oh, wow. So, and that's something that I guess I never thought, you think of chiropractic, but you don't think of the bottom of someone's foot.
Yeah, well, we like to look at the body as a whole.
Okay.
And so we'll see, we do treat many problems that occur in the extremities that are not necessarily related to the spine or back pain. And obviously, when you hear the word chiropractic, you think of back pain or neck pain or headaches, or those types of things. But, we treat lots of different ailments that occur in the extremities too, the arms and the legs. And plantar fasciitis is, if you've ever had it, it's very debilitating because it makes it difficult to walk or run or, enjoy lots of those different types of activities. Extremely painful in the morning, hard to even get out of bed and walk on your feet.
Well, I didn't know it got to that degree.
Well, it certainly can if you let it go. And one of the ways that when I say let it go is you repetitively kind of abuse the bottom of your foot. We'll see this most often in folks who have either really flat feet, so they don't have much of an arch, or they have a real high arch that doesn't get supported well by the particular shoes they're wearing. So one of the ways that we'll treat that in the office is obviously evaluate the foot. We do have custom-made foot orthotics, so basically custom-made insoles that will replace the sole or the arch support system in your current shoe, and that can go into your shoe and support your arch, which allows that not to fall, and which supports that bottom of the foot, the plantar fascia.
Wow, so there's a solution. But first you got to get it looked at.
Oh, you got to get it looked at and then find out if that's truly what it is. And then there's some other treatment modalities that we'll do as well, like we talked before. The cold level, low level laser therapy has been very effective. Ultrasound is effective. We'll do some taping of the arch sometimes. We'll apply some tape, which is sometimes effective as well. So many different ways to treat that conservatively. Now, there's a medical treatment for it as well. A more invasive treatment, which can be successful, but I think it's best to try the conservative approach first.
Sure.
But sometimes the medical doctors will inject the foot with a steroid.
Okay.
So basically, a steroid injection into that structure, which will the hope is that it decreases inflammation.
Okay.
Sometimes they work, sometimes they don't, just like any other type of treatment. There is a surgical procedure, and I'm not totally familiar with the latest technique, but I do know that there's a surgical procedure where they'll actually do a release of that tissue, so they'll cut part of that tissue away from the bone and allow it to and allow that to lengthen, which can be effective sometimes too. But again, I think if you can avoid that invasive surgical procedure, do some things to support the foot. Icing is very effective. Do some treatment, conservative treatment like we talked about. I think that can be very effective as well.
Well, tendonitis, different forms, different areas. Every area pretty much on the body that you've discovered, except for the head. Can we get tendonitis from the neck up anywhere?
Typically not, although there are, that you have muscles, or if you feel in the very back of the base of the skull.
Yeah.
The muscle attachments at the base of the skull are basically, there are tendons there, or where the muscles go into the bone. They don't get as much movement as the other tissues, so you don't develop pure tendonitis there, but certainly can develop what we call myofascial adhesions, or trigger points in those soft tissues in the base of the neck that can contribute to neck stiffness, loss of range of motion, many times headache, pain. And with those tissues, just like anything else, we treat that the same. Find out if there is inflammation in those tissues, reduce the inflammation. Try to return those tissues to a more normal state, if you will.
Well, and they can learn more about tendonitis on the website.
It's on the website at sportandspinalrehab.com. You can always call. We call the office, and certainly we can do a free consultation with anyone. Kind of let them know if they have questions about tendonitis or pain in the extremities. Help them if they can't figure out what's going on. We can try to help diagnose that.
We'll wrap up today's show and we return. This is Sport and Spinal Weekly on 92.1 The River.
Preventing work injuries in the workplace is especially important in this economy when employers need to reduce costs related to work injuries. Chiropractic Sport and Spinal Rehab in Bemidji offers complimentary back safety talks to local businesses with options of complete training and certification, which could potentially reduce workers' compensation claims and insurance costs for employers. If you or your workplace is interested in back safety, please call Chiropractic Sport and Spinal Rehab in Bemidji to schedule your back safety talk today.
Hello, this is Ken Cobb.
And this is Jim Philippi, and we're from Pine Country Insurance in Bemidji.
You know, Jim, in these tough economic times, clients want to save money on their home and auto insurance.
That's right, Ken. And it's also important to help them get the coverage they need. Because when a loss occurs, how good your coverage is will be what matters. You know, Ken, having a good insurance is about more than just getting a good price.
I suppose you're right, Jim. So give us a call at 444-9360 so that we can help you customize coverage that fits your needs, desires, and budget.
Pine Country Insurance Agency, your trusted choice in Bemidji.
Online at pinecountryinsurance.com.
Your trade has never been worth more. From the new and used vehicle superstore, Honda of Bemidji and Bemidji Chrysler, your used vehicle may be worth more than you think. Stop in and see. Drive in and get the best value for your trade at the area's new and used vehicle superstore, Honda of Bemidji and Bemidji Chrysler.
Have you ever been told you just have to live with the pain? Far too many people today are living needlessly with pain and taking drugs to hide their pain. Every day, many people just like you are learning chiropractic care can be an effective alternative to drugs and surgery while restoring pain-free living.
For quality chiropractic care, call Chiropractic Sport and Spinal Rehab of Bemidji at 444-2117. Whether caused by an auto accident, work injury, or other circumstance, receive expert treatment from Sport and Spinal Rehab. Sport and Spinal Rehab will accept most insurance, so give them a call. That number again is 444-2117, or find them on the web at www.sportandspinalrehab.com.
Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
For more information, visit Chiropractic Sport and Spinal Rehab online at www.sportandspinalrehab.com.
Ranger Station.
Yeah, hi. I'd like to report a bear sighting in the forest. 1 second, I'm having a smoke. Next thing I know, I'm face-to-face with Smokey Bear.
Wow.
And he told me it only takes one spark to start a wildfire.
Did you know 9 out of 10 wildfires are caused by humans?
I had no idea.
That's why Smokey's famous and you're not. If you see someone in danger of starting a wildfire, step in and make a difference. Brought to you by the U.S. Forest Service, your state forester, and the Ad Council. Learn more at SmokeyBear.com.
Only you can prevent wildfires.
Like us on Facebook, Chiropractic Sport and Spinal Rehab. This is Sport and Spinal Weekly on 92.1 The River.
Well, this is going to wrap things up for this week's edition of Sport and Spinal Weekly. During the week, remember, you can always email Dr. Erickson and the staff, Chiropractic Sport and Spinal Rehab. Email sportandspinalweekly@paulbunyan.net. Doc, thanks for coming in.
You bet. Everybody get out and enjoy this beautiful weather this weekend.
What is your tip for this weekend?
That was just it.
Oh, enjoy?
Get out and enjoy. We talked about it at the intro. We're talking about it now. Let's get out and enjoy this nice Minnesota spring weather.
We'll do that, and we'll talk to you next Friday.
All right. Thanks, Mark.
Preventing work injuries in the workplace is especially important in this economy when employers need to reduce costs related to work injuries. Chiropractic Sport and Spinal Rehab in Bemidji offers complimentary back safety talks to local businesses with options of complete training and certification, which could potentially reduce workers' compensation claims and insurance costs for employers. If you or your workplace is interested in back safety, please call Chiropractic Sport and Spinal Rehab in Bemidji to schedule your back safety talk today.
Hello, this is Ken Cobb.
And this is Jim Philippi, and we're from Pine Country Insurance in Bemidji.
You know, Jim, in these tough economic times, clients want to save money on their home and auto insurance.
That's right, Ken. And it's also important to help them get the coverage they need. Because when a loss occurs, how good your coverage is will be what matters. You know, Ken, having a good insurance is about more than just getting a good price.
I suppose you're right, Jim. So give us a call at 444-9360 so that we can help you customize coverage that fits your needs, desires, and budget.
Pine Country Insurance Agency, your trusted choice in Bemidji.
Online at